Dr. Red has been involved with education and training for more than 15 years. Originally based in Singapore, he is now in the Philippines, where he is currently the head of teaching innovation and e-learning at St. Luke's Medical Center College of Medicine. His advocacy is digitalization in medical education. Welcome, Dr. Red.
Yes, thank you very much, Daniela, and thank you very much to the Take the Win, the Body Interact team for inviting me to share our experience at the St. Luke's Medical Center College of Medicine. Allow me to share my screen. And my presentation is entitled Evaluation of Virtual Patients from the Student Perspective. We deem necessary to study all the technologies that we introduce to the students on a very universal framework that we use. And I will share that with you today. Um, as a disclosure, this research is part of my role as the head of teaching innovations in e-learning. And my research is partially supported by the Philippine government as a returning scientist. So with that out of the way, to provide you some context, the St. Luke's Medical Center College of Medicine in the Philippines is a private, nonprofit medical school that awards an MD degree after 5 years. So it's a 5 year program, very similar to the American system. We have about 700 students enrolled in our MD program across 5 years. So about an average of about 120 per year level. We have two medical centers, tertiary medical centers, each with more than 800 beds. One is more than 1,000, and it's sufficient to support clinical teaching. But just like what happened in Georgia, Body Interact was brought in because during the pandemic we needed to support our clinical exposure for the students. We besides Body Interact, we use a slew of other augmentation of clinical experiences tools. We call them ACEs. We have virtual outpatient, which is telemedicine software with the use of our standardized patients. We have about 2 dozen standardized patients, portraying about 4 to 5 dozen different kinds of illnesses. We also have the virtual clinical teaching and OR initiative, where we stream OR procedures that directly from the OR from the table, as well as clinical teaching bedside with which you can interview the patients that were operated previously, and of course, Body Interact as one of our centerpiece. We have the fourth one that we will start soon. It is using augmented reality. So we have the standard package for Body Interact, which has 60 cases. All year levels are taught how to use Body Interact, and all are given access. But years 1 and 2 are more for exposure. Year levels 3, 4, and 5 activities are in curriculum, which means they are partially assessed on the use of Body Interact. Year level 4 and 5 rotate in small groups on the hospital floors, and they are the clinical years. And so they utilize BI as they see discipline relevant cases in parallel. So they see real patients and they are augmented with Body Interact. All our technology enabled pedagogy undergo evaluation based on the technology enabled learning evaluation model. So it is a requirement for my unit to evaluate all the pedagogical tools that we introduce under this model. This is quite a comprehensive framework, and it has 4 levels, but I will not go deeply into that. But we are going to focus on the area that is in the red box, which is the learner satisfaction. So I'm going to share with you part of our study that focuses on the perception of the students, the learner's perception. It is quite a hefty um, survey. It has 26 items on a Likert scale of 1 to 7 across 9 dimensions of learning with 3 open-ended questions. Now, it's 1 to 7, mind you. So, and these are the domains that are included from course overview to learning objectives, technology, whatever, what have you, right? You have instructional design, communication. I will go through the significant ones in a bit. And as you can see from the results, Daniela, take a look. The Take the Wind should take a bow because our students like Body Interact very much with an overwhelmingly positive score. The mean scores are all above 6 out of 7 from year levels 3, 4, and 5. As you have noted here, year level 5 is only one group of 12. That's 1 out of 10 groups of 120, thereabouts. Significantly, I will not discuss all of this across the domains because they're all very high scores. But you can see, let me focus on the two lowest areas and one that has a divergent score at the end. C and E are actually technology issues as well as communication, interaction, and collaboration. Many of the students feel that because of the pandemic, when we introduce this technology, some of their hardware and software are having incompatibility issues. But by and large, in an archipelago like the Philippines, and when the students are everywhere and not in campus, we have connectivity issues. And so, connectivity issues is, I think, one of the most significant limiting factor for the enjoyment and learning of the use of Body Interact. And in the second, where communication, interaction, and collaboration are being discussed, many of the students feel isolated when they try to do the Body Interact cases alone. So they don't have many people to interact with or to communicate with because we are not yet using the multiplayer function of Body Interact. So that's one of the things that I think we need to look at. Um, and if you notice that the last item here, I, which has a divergent result between year level 3 versus year levels 4 and 5, and this is because of the way that we handle the dissemination of the cases. In year level 3, they go at it in one class of 138 in this case. Whereas in year levels 4 and 5, they do this as they rotate to the various specialties. They get assigned specific cases that are relevant to where they are. So if they're in obstetrics and gynecology, they get an obstetrics case. If they are in internal medicine, they get an internal medicine case. And because these are small groups, instructor support is very much provided. And you can see the difference in the experience with scores of 5 versus 6. 5 is still good, but you can see there is a significant difference there between year level 3 versus year level 4 and 5. This is the global response that I would like to focus on with regards to the three open-ended questions. And the students keep on harping about learning how to take care of patients, managing the patients under time pressure, that Body Interact is a good practice, and feedback is a necessary tool for them to learn, and that learning and simulation and learning go hand in hand. And in this particular case, they even during the survey requested for more cases, which is why it was an impetus to us for us to increase our cases to the standard 60. So this is our learning. I think I'm at the end of my 10 minutes. You can see that the use of virtual patients is a highly positive experience for our students. Limitations of the Body Interact are mainly technical, with connectivity being the foremost. We shall consider adding multiplayer function. Hopefully, Body Interact Take the Wind can consider using or putting multiplayer function as a standard feature rather than as a premium feature. Body Interact works best as part of small group assignments with dedicated mentors providing immediate feedback. I think our future with Body Interact is to try it with complementary tools such as with simulators, plastinated specimens, even in anatomy, and what Dr. Dea has mentioned earlier, uh, using it for OSCE. So again, thank you very much for giving me the time to share our experience with you. And for any inquiries, you can see my email on the screen. Um, and with that, I would like to thank you very much all for your attention.